Hello there and welcome back to Hillsdale Hospital. It's great to have you in the studio today. I'm J.J. Hodshire, President and Chief Executive Officer, and in the studio with me, a great friend, the funniest guy I know, honestly. The guy is funny, but above all of that, he is one of the best surgeons, I would say, in our country, and I say that with all sincerity. What is remarkable about you, Dr. Stockall, is that you invest in rural hospitals. And I think that's where your sweet spot is. We're going to talk about that today. But before we do that, I would like our listeners to know a little bit about you. Where do you hail from? You know, how long you've been doing this? What do you do? Before we get into the meat of our discussion.
So I'm a urologist here in Michigan. I've been in practice for close to 40 years.
Wow.
I'm married, 3 kids, been with my wife for 40 years. Rural health has always been a sweet spot for me. When I was in my training many years ago, we did outreach clinics, and throughout my practice career, I've always had a strong rural connection. What excites me about rural health is the often the unmet needs, because there's often a shortage of specialists in the community, and I'm excited to see ways in which we can bring specialists through the rural community to help save patients from travel and therefore increase the quality of their care and the timeliness of their care. So I'm excited to be here.
Yeah, it's always great to have you here. And I want to make a note that Dr. Stockall actually has a practice here, an active practice, a very busy practice. He also does surgeries here as well as many other places. You travel around the state, and you know, you've had practices up north. You have practices obviously now at the southern part. You see a lot of the similar types of patients. You are in a lot of impoverished areas. You're dealing with a lot of individuals that are suffering comorbid conditions. Financial decision making often plays a role in why people don't seek health care, right? And you probably see some of the most difficult cases, I would assume, in some of these rural communities. Before we tackle some of the rural issues, explain to our listeners, what is urology? I mean, really, what is the core of it? What types of things do you do? And really give them a sense of what that looks like.
So urology is men and women's health, and it can be things from urination issues in both men and women, sexual dysfunction issues, and issues relating to cancer, bladder cancer, kidney cancer, prostate cancer issues. And then kidney stones is a big part of urology. So urination difficulties and kidney stones and cancer issues.
Yeah, and when you think about a patient who typically would come to you, that you get most likely a referral will be made by the primary care physician. You take that patient, but you have options to do that surgery in different areas. But you have patients coming for routine, kidney stone, to some complex cases. Can you give our listeners an idea what's a complex case that you would deal with? When would you get involved in really a major surgical intervention?
Well, we deal with complex kidney stones. We certainly have the capability of doing highly complex kidney stones here at Hillsdale Hospital, and have the most advanced equipment available anywhere here. Some of the other advanced kidney stone surgeries that we would do are, laser treatment of kidney stones, but also percutaneous shock pulse and ultrasonic lithotripsy for very large kidney stones that are not amenable to other treatments, and new technologies of enabling us to take out kidney stones in a minimally invasive way.
So Dr. Stockall, you know, one of the things that none of us want to hear is the diagnosis that you have cancer. and you've walked a lot of men and women through those diagnoses. When you think about prostate cancer, this is something that you have experience in working with a team. Right now, in your practice, in your primary practice in Lansing, Michigan, you have access to a team of individuals that you work with. How does that relationship play once the patient's been diagnosed, let's say, with prostate cancer? From their primary care refers them, there's been a diagnosis, they come to you, talk about intervention, and then what happens next? Do they go back to primary care? Do you send them to a specialist? Are you going to be monitoring them frequently? Talk to us a little bit about what that looks like.
So we take on a multidisciplinary approach with cancer care. As a urologist, we're cancer specialists, so we'll often treat both the surgical and the medical aspects of it. And often, if the specialists aren't able to come to a rural community, we'll often take on the role of the medical oncologist as well. But it's done as a joint process where we'll have tumor boards, and often the tumor boards are done via telemedicine, which can help allow patients not having to travel so far.
Yeah.
So.
And so then let's transition to just, individual wants to make an appointment with your office. They come in. They're going to be most likely met with a physician's assistant, a nurse practitioner, right? Mm-hmm. The workup will be done. When do you get involved in the care beyond the NPPA?
Sure. So I'm always involved, even from the onset of taking on new patients, and that we're directing the physician assistants and closely as to the onboarding of their care and the treatment plan and follow-up. Of course, when it comes to surgery, I'm always the one that's going to be doing that.
So Dr. Stockall, can you talk to us a little bit about what can you do in an office versus what you do in the OR? Because there's some procedures you're just going to do in the office, right? Not everything has to be driven back to the ORs. Mm-hmm. Is that correct?
That's correct.
What is the different? What are the procedures?
Certainly, we do vasectomies in the office and some other minor procedures.
Mm-hmm.
Were often done there.
Do those require pre-authorizations in most cases, and individual has to get their insurance? Mm-hmm. And then, if that's the case, does your office work on all that? Do they do it?
Yeah, we normally get the pre-authorizations done for the patient.
Okay. So from A to Z, you're taking care of that patient. You're assisting in getting them booked for the OR, for the case, and then you show up. And then post-surgical, you or your PA are visiting with that patient, correct?
Correct, following up the patient.
And you're following up with the
afterwards,
patient.
Yeah.
So let's transition a little bit, because you've done a lot here for me at Hillsdale Hospital, and I want to thank you. You've brought a tremendous amount of new patients and volume to our hospital. And I remember the early on discussions when I said, man, you're busy, and you laughed at me for probably what felt like hours. And you're like, you haven't seen anything yet. And then you started getting even busier. I thought, how is this happening? But you do a lot here. And one of the things that I want to talk to you about today is we're involved in UroLift. And there's a lot going on with BPH. I want to talk about that today before we close out our segment. So what are we doing in that area, and what is BPH? What is UroLift? What are we doing that's new and innovative?
So BPH, or benign prostatic hyperplasia, is a condition that will affect about 50% of men at some point in their lifetime. And it will cause men to have difficulty urination. It's a benign growth of the prostate gland, which occurs as men age, related to the male hormone testosterone. Many men can get enlargement of their prostate and never have any symptoms or side effects from it, but there are many men that will have difficulty with their urination. And this can include slowing of the urinary stream, frequent urination, and having to get up at night. So what has recently been developed is a minimally invasive procedure to help treat that. And this is called a UroLift. And what the UroLifts are, they're implants which essentially tack the prostate back and open up the channel so that it can pee better. It's minimally invasive, done as an outpatient procedure, and often do not need to have a catheter with it.
So Dr. Stockall, I want to talk about, before we close here, a lot of people come to me in the community and say, JJ, we get our blood drawn at your place, but if we need major surgery, we're going out of town. I mean, we're doing major surgery here. You're doing this type of surgery at major tertiary centers across the state of Michigan. We have the capacity, correct, to engage in these type of procedures.
Yes. Yes.
And the skill set of the staff and the training of the staff. I think that's important to know, of the level of experience and education.
So I think one of the advantages of outreach to rural health that when patients have serious diagnoses, if they can be seen primarily in their rural community, some of those patients, of course, the things like I was saying with advanced kidney stones, we can do here, and many even of the cancer surgeries can also be done here. Those things that can't be will be done at other centers. However, the ability to follow up afterwards here, someone who's done your surgery, I think is a major benefit to the patient in allowing continuity of care if they're a problem.
Absolutely. So local services right here at Hillsdale Hospital, the same type of services that you would get at major university hospitals, at tertiary centers, major academic centers, happens right here in your backyard. Experts, amazing surgeons like Dr. Stockall. If you today are suffering from incontinence, that's another issue that you're dealing with right now. Mm-hmm. You've spent a lot of your time, I would say, in ministry to patients, helping them function and cope with their everyday ailments, but get them back integrated into society. And one of those areas is incontinence. And you're working in that realm right now, correct? Right here.
Yeah, and we do many different types of incontinence surgeries, from a relatively minimally invasive treatments like Bulkamed, which are simple injections for incontinence, to more involved things like slings or even artificial urinary sphincters, at the most highly complex treatments of incontinence. So.
I had a church member come to me and say that you transformed her life, because in many cases when individuals are incontinent, they don't go out. They're afraid. Her life has been transformed. That's life-changing, Dr. Stockall, and that's the work that you're doing. So thank you for your contribution both at Hillsdale Hospital and in our community. It means a lot to me, so thank you very much. We appreciate it.
Thanks. I appreciate the honor of being here.
You can reach out, find it on our website, hillsdalehospital.com. You can look under urology and see where his office practice is here at Three Meadows, as well as what type of procedures can be done here. New and emerging technology always being offered up for our patients, and Dr. Stockall is a professional who absolutely advocates for his patients to have the best care possible with the best devices at his disposal. Available, which we make available to him. So for more services like this, look online at hillsdalehospital.com. And thanks for joining us today. And always remember the power of rule.